Hi, everyone. This is Dr. Mary Balliat. I am the co-founder and chief science officer of Potential Power Nutrition, and I'm a professor emeritus at Northeast College of Health Sciences, where I taught for 30 years. And my special guest today is Dr. Matthew Fraczek-Syczyk. He is a chiropractor. He graduated in 2021 and started his practice, and he has done a great job having a nutrition practice. And he's a frequent guest of mine because he is an expert in reading blood work for his nutrition practice. So I'm going to let him answer the question, what made you get interested in having a nutrition practice and why focus on blood work?
Awesome. Well, thank you, Dr. Balliet, for having me today. No, I've always been interested in nutrition. Coming up through the chiropractic program, we learned a lot. I had you as a professor, obviously, and I loved the interworkings of how nutrition played into healthcare and from an Eastern to Western medicine perspective. I always liked, even younger age, like a kid, I loved watching shows how to figure things out. Like I loved watching House growing up as a kid. I didn't understand the medical side of it, but always trying to figure out like what was the main cause, why, not why did someone have some like some symptom, but what was the cause of it. And so, I like to very analytical person, so trying to figure something out using blood work is right up my alley.
Cool. That is really cool. I think I'm recording that it's on the thing, so I'm going to cut the screen down. So here's the deal. We're actually going to talk today about what would it take if other people want to start a nutrition practice and focus on blood work, especially that he's done it in such a short amount of time. What did it actually take? So let's answer these really important questions that he researched for us. And number one, can chiropractors order blood work with just their license, or do they have to have a master's in nutrition or some other credentialing?
Right. No, that's a great question. So in the state of New York, you all you need is your license in chiropractic to order blood work. There's actually a vast array of like different labs that you can order. I was kind of surprised at what we could, which is awesome. What's a great resource for people actually is to go, let's see here, to the Federation of Chiropractic Licensing Boards. You can click when you get onto the website here, the first link when you go to Chiro Boards, click on Chiropractic Regulatory Boards, and it brings you to a page and it has all the states. You click on your state and it gives a whole scope of practice layout for chiropractors to see if you can order blood work. Sometimes it's a very vague paragraph, but you can always, there's a phone number at the top and then you can get different resources and find, sometimes you just need to call someone and answer the question and they'll redirect you to someone else. But in New York, it's yes.
That is so great. Yes, I always order blood work. Do I have to have hospital privileges in order to get blood work? And if so, how would I get them?
Right, right. You don't necessarily need hospital privileges. Sometimes it'd be easier depending on where you're located in a more of an urban versus rural area. The hospital may be the only source you have. So I went ahead and I actually called one of the hospitals near me, their phlebotomy lab, and just kept asking the question until I got someone higher up the chain that could get me set up there. For me, the one hospital nearby, I do have the privileges, but it's actually easier for me to use one of the outpatient labs. So in New York, we have LabCorp and HealthQuest. I've got set up through LabCorp to be able to order blood work for people really easily.
Does insurance cover that?
Yeah, so it depends on the insurance, obviously, but when I order blood work for people, actually, let me go to the next slide here. So this is what my dashboard looks like on LabCorp. So it's a little confusing. So I recommend you to, when you get set up to have someone walk you through it. But when I put in an order, um, when I put in an order for someone, I also enter their insurance information and it'll tell me based off of the diagnosis codes I put in whether the blood markers I order are covered by insurance. But I haven't had any issues up to date so far.
And are there limited, like what if the patient already had blood work done? Can you use that?
Right. So for me, what I've done for some of my program I've done so far, if they've had blood work done within the last 6 months, I usually have them bring it in or email it to me if they're okay, if they're comfortable doing that. And if it's sufficient blood work, then I can do an analysis off of that, or I leave it up to them. I could just order a whole new panel and get that done as well.
Oh, that's super cool. And then what kind of limitations do you have for ordering blood work?
Right, right. So, there's always going to be limitations. So sometimes patients will have like a specialist they're working with, like an endocrinologist, for example, with thyroid issues. So I don't want to ever step on their toes. So I always, if they recently ordered blood work, then, I'll have to wait a certain amount of time, typically at least 3 months, in order to reorder those same labs. Um, but overall, it's usually pretty easily, especially with like a company like LabCorp or HealthQuest.
Oh, that sounds great. So basically, what I'm hearing you say is if they have blood work or you want to do follow-up blood work, on average, you're waiting 3 months to see how the numbers are changing.
Correct. 3 to 4 months, depending on the patient, depending on which labs are out of range and what we're trying to work on.
All right, so now let's say that I either had hospital privileges, which we're allowed to have in New York, and like you said, that you had gone and you can just go bizarrely and just say, here's my license, and they give you lab privileges. But now you've got this, you've gone onto your portal, you've ordered the lab work, you've put in their insurance information, and now you're going to look at the results. What do I do now? How do I get that?
Right. So let's go to the next slide here. So, well, here's one of the panels that I usually order for everyone. So once I write the script, once they get their blood work done, for the LabCorp account that I have, it sends me like the actual results. I can look on the portal. So I'll get it depending on what I order. If I ordered a panel like this, it would probably come back in about 3 or 4 days. I'll get the whole report. I can print it out, bring it in, and I basically highlight it and go over it with my patient.
Great. And then this was your custom list. What made you choose this list?
Well, it's an ever-changing list. I've, ordered blood work enough times, and I see what most patients have deficiencies in. And so I go through what people typically get. It's a CBC, a metabolic panel. But over the years, from insurance issues and, different hospitals, they started taking away things that they typically order for people. Like they don't usually order vitamin D on most people. They don't only do an A1C if you have a history. Some of these other markers, like the thyroid markers, are more specific. They'll only look if you have a family history of a thyroid issue, but it's really important diagnostically to order all these different markers to see what's going on with each person individually.
So basically, this would be your custom pick list is sort of your top 10 things that you want on almost everyone.
Correct.
Oh, that sounds really cool. That sounds really good. And then once you get the results, what's the next step?
Yeah, so the next step is I can either analyze it by hand, looking at the reference range or their optimal ranges, or I also went through a course and they have a software that can do that for me. So here's a quick snapshot of part of one of the blood work analyses that I did, and it shows here the actual optimal range for each marker, the standard reference range. So the reference range is typically what the medical field looks at for a marker. So for example, fasting glucose, you typically see between like 60 and 100 is a very common one you see. So they have 65 to 99. And so that's like what, a wide range is for, for example, they say like shoe sizes, for women, you say like on average, most of the population is between a size 5 and 10, but really most people are like 6 and 8. So that's more what that optimal range is right here. And so this is where we want to be. And if you're a little bit out of the optimal range, it tells us one thing, but if you're outside of the standard reference range and there's something more, not necessarily more serious, but something more in depth we have to look into.
Good. And say somebody was interested in getting a report like this, what did you have to do to be able to use this? It says it's powered by Optimal DX. So what did that take to get you to get that program?
Yeah, so actually one of the textbooks I use that I originally, when I first started doing blood work analysis, was written by a naturopathic doctor, Dr. Dickon Weatherby. And so I looked him up because I wanted to see a more up-to-date copy of his textbook. And I found that he taught this course called Optimal DX. And I just did some research on it and it sounded really cool. And I just went online, paid for it. I found a coupon online, just like anyone would want to do. And it's a 12-week online course. You can do it at your own pace. And they have a software that you can use afterwards to input all the blood work and analyzes it for you.
Oh, that sounds cool. All right, now you have this, and now let's say I'm your patient and you have this results. I see that there is green. I'm gonna assume that's good, and yellow, maybe like caution, and red, that sort of is like you better stop here and do something. That's how it looks to me. What would you tell me if I had this blood work?
Right, right. No, I mean you hit the nail on the head there. The green is in the optimal range, yellow is outside, or yeah, green is within the optimal range, yellow is outside the optimal, but within the standard range, and red is outside either high or low of the standard reference range. So for this case specifically, their fasting glucose is a little elevated. Their A1C is in the pre-diabetic range. There's some very advanced markers in here that, sometimes aren't always clinically relevant. I won't get into the details of it, but basically looking at this person here, they definitely don't regulate they probably have a sweet tooth. They like to eat their sugars. We want to talk about their carb to fiber ratio when eating certain foods on nutrition labels, upping your fiber overall. Lots of times it's if I looked at the whole blood work, I'm sure their neutrophils would be high because they're eating more processed foods in their diet. I could tell a lot of different things from that. But overall, like their kidney markers look pretty good. I won't go into everything in here, but mostly to work on their sugar regulation.
So it really is just the way it looks. If you already are a doctor, then a chiropractor, acupuncturist, you can see like, oh, this is the wrong color in the blood glucose area. The program helps you figure that out, and then you can then address that. And then you have an outcome marker, is my guess. So when would I redo this? You give them the recommendations, like you just said, cut back on your refined sugar, add more fiber, learn to read your carb fiber ratio, and teach them how to read a label. How long would you make them do that before you would look and see, did their markers change?
Right. No, it's a great question, and it depends, on the marker. But as we learned in biochemistry, that the red blood cells have a 120-day life cycle, so that's roughly 3 months. So I usually wait between 3 and 4 months before I'd reorder someone's blood work. But so usually we want to, that's a great time to check up to make sure they're still doing what they should be doing. It's good to check in on them sooner, because if you wait 3 months and they haven't done anything, then not much is going to change. So it's good to stay on top of your patients or clients in the program.
That actually brings up the most important thing, I think, about those of us who do nutrition practice. For you, who's taken this blood work, who's done all this, how often should you be checking on patients or coaching them? So you're going to tell them, here's our initial blood work. In 3 months, we're going to see if we made a change. But in the meanwhile, I need you to come in how often, so that you are asking, how are you doing? Are you staying on the program? What way do you actually then coach them? And if you're doing that, is that a visit? Like, how does that actually work?
Right. No, that's a great question. And it's a little different in the office I'm in, because I see patients on the chiropractic side and the nutrition side. So sometimes I'll see them a couple weeks afterwards and I'll talk, nutrition during their chiropractic visit. But for the ones that don't come in for chiropractic, just nutrition, I usually set up about a month later. Like I'll usually send them an email the next day, kind of following up with all this information we talked about. Because I say, when I give you the report, it's like trying to drink from a fire hose. It's a wealth of information. You can't remember it all. So I recap everything for them, and then I usually follow up with them a month later and go from there.
Great. And so basically you're going to see them once a month. So 1 month in, 2 months in, 3 months, we're going to redo the blood work.
Correct.
And if they happen to be also a chiropractic patient, then you can check on them either every week, every other week,
Way more often.
way more often. And so I just off the cuff, are the chiropractic patients who have nutrition, are they more compliant? Do you get better results?
Oh, that's a great question. Honestly, I would probably say just the nutrition patients are a little bit more compliant, because they come in just for that. The ones that are chiropractic, I'd say, are 50-50, because they come in and for the chiropractic, oh, I'm interested in nutrition. And I do the report with them and they're like, oh, this is great. And then they skip their next chiropractic visit because I don't think they wanted to talk to me about how they didn't do what they were supposed to do.
And then so that's very funny. So then how do you follow up on them?
I'll shoot them an email to try to see how they're doing overall. But you can lead a horse to water. I try to follow up with them, but I don't want to be too pushy at the same time. So I give them my analysis and let them. I try to educate patients the best I can to so they can make the best decision for themselves.
Got it. Yeah. But they're still, even if they missed their chiro appointment, they didn't leave that first appointment without that follow-up month later appointment, right?
Correct, correct.
Okay, great. So then they become a nutrition patient, even if they're avoiding you for a
E-
little bit. And
Exactly.
oh my God, that's so funny. All right, that's really great. And so what would you say to wrap this up then, as we're having the videotaping this so that the doctors can watch this and make some decisions for themselves, as this is something that they would want to do. What has this added in value for you, for patient care, for outcomes? Why has this worked so well?
Yeah, I mean, I could go in a lot of different directions with that, but to summarize best, um, I would say it's really good just to have a wealth of knowledge. I always tell patients the more information you have, the better. And so some patients who, weren't getting better, doing like a specific treatment with them, working on getting rid of like inflammation through their diet, like helps a lot of people. Getting set up with this was honestly, for me, it was probably harder because I had to jump through all the hoops and whatnot. But if you kind of just go to the resource that I showed you, you just go to like LabCorp or healthquest.com, make an account, just call up someone and get someone on the phone to explain it to you, like you'll be like months ahead of where I was along the process. So the best thing you can do is just try to just take one step after another. It's all a process, it's all a journey, and they say it's about the journey, not the destination. But we all want to get there too, but you learn a lot along the way. And um I enjoyed all of it. So
And when my final question is, when you actually are then going to give recommendations, uh, what what are the patients most compliant with? Like, what kinds of things do they seem to say, "Oh, I can do that"?
right, right. No, with most patients, looking at, usually there's not just one thing going on. There's a lot of markers that are mildly out of range. So it's really important to have a foundational nutrition. So we want everyone to have, something that's going to take care of a little bit of everything. And so typically for this person, you could recommend like a fiber supplement or something to help like with their gut if there's something going on from the blood glucose levels. But having something with foundational nutrition that's got a lot of different vitamins and minerals that will help with not only digestion but absorption of all the different vitamins and minerals. And everybody needs a little bit of everything throughout their day. It's whether it's like I talk to patients, they have like spasms or like in their leg. I'm like, oh, it could be calcium, could be magnesium, could be you're not drinking enough water. So it's usually a combination thereof. So it's never just one thing. So having a good foundation is really important.
Great. And then anything in terms of vitamins or minerals that you'd be like, this is really good, and look for these kinds of things, and this is not as good, or do you have something that you love or don't love about forms that you want to address?
Right. So it's important for like for example, like vitamin B12. There's usually you see out in the if you look at your nutrition label, it'll say cyanocobalamin, which is like the really quote unquote cheap form of it. Our body, some people can digest it well. There's another presentation that Dr. Balliet does with the MTHFR gene, where some people can't absorb the right form of folate or to convert folic acid, folate into folic acid, a methylfolate rather. And so having a high quality version of B12, for example, a methyl B12 is really important. A lot of supplements now, they have a methylfolate and a B12 folate, methylated B12. But the point being is that you want something that's, good all the way across the board, but it's high quality, but not a very high dose. What's a daily dose needed for each person.
Great. And if you were to say to somebody who's considering this, right? Uh, how long did it take you from saying, I'm going to start doing this, did you had to do the course first, or could you have used some regular blood work to start with and get your feet wet, and then you did the blood work? How'd that work out? That's our wrap-up question.
Yeah, yeah. No, I mean, so I initially just used the resources that I had from my master's in nutrition, which you don't even need that. But if you had something just like you have here, you can start just like analyzing blood work, and you're going to learn from every single patient. Like I'm still learning every time I analyze another blood work. I'll look at something like, oh, like this worked for this person. Maybe this would also work for them. So we're always learning. And so I just don't be afraid to I guess what I'd like to say is don't be afraid to be wrong, because you're going to learn something, along the way. So I think that's what gets in the way of most people, is that they're too afraid that they're going to screw up, that they don't even want to get going. So it's important just to put in the effort and, learn along the way.
That's great advice, right? It's practice, not perfect.
Exactly.
So I think all of us know that. That is really great. Well, I want to wrap this up so that everyone can watch this. And so I want to thank again, Dr. Matthew Fraczek-Syczyk, and I will put this up. And if you need to get a hold of either of us, my email is mballiet@potentialpowernutrition.com. And Dr. Matt?
And then my email is drmattdc@outlook.com.
Great. All right. Thank you, everyone. And have fun looking at people's blood work.